So today we are very lucky to have a great speaker named Eve Abrams who's going to be talking about her series Unprisoned. And I'm going to start out with a little bit of an overview on why mass incarceration is a public health issue. I know this is a public health audience, so I probably won't have to do a whole lot to convince you, but I just want to make sure that we have a good framing for why those of us who are in public health should care about this issue. And I should introduce myself. So my name is Ashley Wennerstrom. I am an assistant professor of clinical medicine over at the School of Medicine, and then also an adjunct assistant professor here at the School of Public Health. So what is mass incarceration and why is it a public health issue? We have a very interesting situation in our country today where we have about 2.3 million people who are under some kind of correctional control. About 1.3 of those are in 3 million of those rather are in state prisons, and then a huge portion also are in local jails. But when we think about how massive this problem is, this is almost 1% of our entire population in the country. So this is quite significant. We also see that the rates of incarceration have increased tremendously, particularly over the last 30 to 40 years, very much in part due to the war on drugs. And we see that Louisiana is unfortunately leading the nation in rates of incarceration. We are the largest incarcerator in the entire world. We've also seen a very significant increase in the rates of women's incarceration over the last 30 or 40 years. Oftentimes when we think about incarceration, we tend to think about it as an issue that affects men because there are so many more men than women who are incarcerated. But I want to make sure that everyone is well aware that the rate of women's incarceration is also increasing quite a bit. As we're thinking about mass incarceration as a public health issue, the next thing that we have to be considering, as we always do in public health, is are we experiencing any racial or ethnic disparities in our rates? And unfortunately we are. About 1 in every 106 white males is incarcerated, in contrast to 1 in every 36 Latino or Hispanic men, in contrast to 1 in 15 African American men. So huge racial disparity there. Some other issues as we start to think about mass incarceration as far as it affects individuals who are incarcerated. Also want to keep in mind that we use solitary confinement a lot in this country. We have about 80,000 people in the United States who are in solitary confinement, which has significant health consequences, particularly around mental health. I've got photos here of a couple men who were incarcerated for very long periods of time in Louisiana. The one at the top is Herman Wallace. He spent 41 years in solitary. And then Albert Woodfox spent 43 years in solitary and just got out last February. He's talking about, in this quote here, about how difficult it is for him to even reintegrate into society after having lived in a 6x9 cell for so long. Also want to think about the status of people who are incarcerated as far as health issues go. Rates of chronic disease are usually about 2 to 3 times as high as the general population for people who are locked up. Rates of serious mental illness are about 3 to 4 times higher than the general population. And then we see about a 10 times higher rate of some other health conditions, including HIV, hepatitis B, hepatitis C, and also tuberculosis. So these are significant concerns. Recently did a study of healthcare access among formerly incarcerated people in Louisiana. And these are just a couple of quotes from this study. But they illustrate a few things, one of which is that inmates are often required to pay for their own health care, which means that they may forego health care if they don't have the funds for it. And certainly people in prison often do not have a whole lot of access to income, as you would not be surprised to hear. And there's also a lot of concern that prison health care providers may ignore the health concerns that are raised by inmates. Certainly that is not true in all cases, and I don't mean to say anything disparaging about those who are providing health care in prisons, but there are a lot of anecdotal reports, and we're seeing more and more that people who are incarcerated may not be getting adequate access to health care. We also want to think about what happens as a public health issue when people are released from prison. And there is evidence that the relative risk of death is about 12 times higher in the first 2 weeks after people are released from prison. And those deaths are generally due to homicide, suicide, drug overdose, and cardiovascular disease. And then people also face incredibly significant challenges in accessing things like housing, healthcare services, federal assistance like food stamps, and then certainly jobs due to policies that have been put in place that make it very difficult for folks to reintegrate. Also important to keep in mind that one thing that very frequently happens is that people who have spent time incarcerated are not able to vote when they return to society. It differs by state. There are various laws, but it can be very difficult for people to be members of society in a full and meaningful way when they're no longer allowed to participate in the democratic process. And we have to think very carefully about racial and ethnic disparities here again, as we're seeing so many people of color who are incarcerated and then seeing that they're being systematically denied the right to vote. This is a serious problem. There's currently a class action lawsuit going on in Louisiana right now that's focused on getting voting rights back for people who have a history of a felony incarceration. Moving from the individual, also need to be thinking about the effects that incarceration has on families. These are just a few simple statistics from some community-based research that was done with several community organizations around the country, and the citation is there. But it's important to know that about 2 in 3 families say they have difficulty meeting basic needs while they have a family member who's incarcerated, oftentimes because a member of the family is no longer able to contribute to the family income, and certainly because it's very expensive to pay for things like legal fees, bail, and then even just visiting and phone calls to prison can be incredibly expensive. Also want to be thinking about the fact that at this point there are about 2.7 million children who have a parent either in federal or state prison. Certainly many more kids have parents who are in local jails who may be there for shorter stints or awaiting trial. And this has a huge effect on child development. Children who have incarcerated parents are less likely to complete college as they grow up, and they have higher rates of a lot of significant health issues, include attention deficit disorders, obesity, anxiety, depression, and even asthma. And then we also want to be thinking about, as we're thinking in the public health context, about how incarceration affects entire communities, so not just the individuals who are incarcerated or their families directly, but what is the effect on communities? And what we see here is a couple of different slides that illustrate the rate of incarceration in some communities in New Orleans and then the cost of incarceration. There's a great website that features what are called $1 million blocks that show how oftentimes we're spending $1 million incarcerating a single block, and certainly all of the money that's being used to keep people incarcerated could be used to affect change in many other important social determinants of health like education and housing. So with that framing, hopefully I've convinced you that mass incarceration is a public health issue if you weren't convinced already. And so now I'm going to turn things over to Eve Abrams. Again, she is the producer of the series called Unprisoned, and we're very grateful to have her here today.
I was just saying I want all of those slides because they so beautifully conveyed so many of the collateral consequences of mass incarceration. I sometimes refer to it as the incarceration binge because it is definitely something that we've come into in the last several decades because of the war on drugs chiefly. So yeah, so I produced I'll say produce in the present tense because I'm hopeful that we'll get more funding. I produced the series Unprisoned, which aired on our local public radio station, WWNO, as well as the premier news and talk radio station geared toward an African-American audience, which is WBOK. And I should say that New Orleans, both of those stations are New Orleans. And the funding for this project came from an organization called AIR, the Association of Independents in Radio, and they funded 15 projects across the country that were tasked with finding America, uncovering the stories, going to the corners of America that aren't talked about. So I live in New Orleans, and it was abundantly clear that this was the elephant in the room that nobody was really talking about. I mean, we talk about mass incarceration here, and certainly our newspapers and our news reports are flooded with crimes, right? High profile, mugshots, that sort of thing. But I found what was really lacking were stories about the people who are affected by that, the ripple effects, all the human stories of people who live in the neighborhoods and are related to the folks and who are coming home from prison and all of those things. So my project aimed to put a net around some of those stories, to capture them and to help amplify those voices. So as you can see, I'm white. I'm a woman. I grew up in a middle-class family. That's my experience. That's the perspective I come with to any work that I do. And so my task is to really listen to other people, hear their experiences, and help turn over the microphone to them. I think we hear a lot of people like me on the news, and it's not a forum where we hear voices from all corners of America. And that was my task. That was my personal task, as well as the goal of this program. So I produced 14 stories. They've all aired on WWNO. There's one more airing on WBOK if you want to get up in the wee hours of the morning, 8 o'clock a.m. on Monday. We'll have the final story airing there. But of those 14 stories, I produced 2 of them with 2 other people. One of them was co-produced with a young woman named Courtney Williams, who's a communications major at Xavier University. Because one of the first things I did when I began this project was I went into classrooms, both high school classrooms and college classrooms at Xavier, and I played stories about mass incarceration that I did not produce. And then I had discussions. And that's how I met Courtney. She's a native New Orleanian, and she was just extremely well-versed in criminal justice issues, extremely smart. And so I approached her and said, hey, can we work together? And so we produced a story together where she interviewed family members who, she interviewed a cousin and her aunt. And her aunt's, the tape with her aunt is what we ended up using in a story. And she had a real intimate family conversation about what it's like to be a mother whose 2 sons have been incarcerated, what it's like to be black in New Orleans, what it's like to worry about going out for a gallon of milk at night because you're black and you'd have to drive in a car to get to the store, those kinds of things. So that's that story that I made with Courtney. And then another story was made with a young woman named Asha Lane, who was a senior at the time at both the International High School of New Orleans and Bard Early College Education, which is where I met her, and she's now a first-year student at Bard University. And Asha and her classmates were really interested in talking about how the ethos of our carceral society has spilled over into their New Orleans charter schools. The discipline, the security, the way they feel like they are not being supported as learners, but in fact being looked upon as criminals. So Asha and I reported that story together. She got amazing interviews with her classmates at Bard about the different types of discipline and security at her school, and then we went together and spoke to principals of those schools. So that's a really great episode as well. And I just want to say, so much of what Ashley talked about, it's in our episodes. We have an episode about children I went into a class at Sci-High, and just in casual conversation about these other stories, I learned that roughly a third of the kids in the class had a close family member who was incarcerated. And that played out in every classroom I went. This is normal. These young people thought of that as normal. They weren't embarrassed by it. They were perfectly willing to talk about it in their classroom. So we did an episode talking about those issues, many of the statistics that you saw up on the screen. What happens, the trauma, the stress to a family when you've got a parent who's locked up. And also the trauma and stress for that parent. How do you be a parent? How do you parent from a distance? So that's an episode we have. We have an episode about reentry that gets into some of the many, many issues, finding housing, finding a supportive network when you get home. And then, well, anyway, let me just say, I'm going to play some episodes for you, but I brought cards that tell you how to get in touch with Unprisoned, how to listen to all the stories. Please feel free to do, because a lot of the issues that were mentioned, you're not going to hear about them today, but I talk about them. So take one of these on your way out. So these stories aired as a radio show, but they're also a podcast. The same story appears on both. So as a podcast, the only difference is that you can download it and play it at any time. And it's on iTunes and Stitcher. So let me also just, before we play the first episode, I want to say that my perspective, professionally, is that I've been an educator for over 20 years, and I think of myself as an audio documentarian. I don't really think of myself as a reporter or a journalist, though I recognize that those are apt labels. But I'm not going out there in the world to get a story. I'm going out there to listen to people and hear what they have to say. And what I learn from them, that informs the scope of the story. That's how I go about the work that I do. So it's really listening to human beings. And I think that listening to human stories and presenting the humanity in the people involved in all these statistics are so alarming, but come on, we're bombarded with horrible facts and figures every day, right? So how do you pierce through that? And I would argue strongly that the power of the story, hearing another human being's personal experiences, you empathize with them, you feel for them, you understand that this person, though not me, though lives in a different city than I, though looks different than I, they're a human being made of flesh and blood just like I am. I can empathize with them. Oh my God, this is a terrible situation. We've got to change it. So that's my intent, is to bring about awareness through revealing, through amplifying the humanity of the people involved. Another really important thing about this series is that it was made to air on a public radio station, and I did not come armed with the statistics of who listens to public radio, but rest assured, it's overwhelmingly white, and I think the mean age of our radio station listener is something like 55 or 60. It's old. Okay, and it's usually somebody with money, with wealth, and I think that was a common thing that happened when, you know, everywhere I've gone over the last 9 months, the grocery store, you know, the club, whatever, the bar, people come up to me, and if they're white, they say something like, thank you for telling these stories. I didn't know it was so bad. I didn't know the problem was so big. And then black folks are like, oh yeah, thank you for telling the stories. It's like it really brought to bear how differently we understand this crisis going on in our society. It really does break down on what your experiences are, who you are as an individual. So I was trying to create a space, a platform that would enable dialogue. You know, you can refer to this story. You can say, I heard this on public radio, you know, and that way we could have a more unified conversation. I think, you know, we're in it together, sink or swim together. This is a civic setting, so I think it's incredibly important to make sure that we're not just looking out for our own, but that we're thinking of our own more expansively. So, without further ado, I'm going to play the third story that was on Unprisoned. The first one was about voting, because as you heard, your voting rights are in many, many states. It breaks down on state levels, but on many, many states, your voting rights are stripped away, often when you're incarcerated. In the state of Louisiana, you do get the right to vote after you are off paper. And what that means is you're done with your sentence, but you're also you're not on parole and you're not on probation. So in the course of that story, I did meet a man who was arrested. He had I can't remember the small amount of heroin he had. It was a personal use. It wasn't for distribution. He was out of prison. He'd served in Angola, but he was on parole for the rest of his life. So he would not be able to vote for the rest of his life because at one point he'd been a heroin user. So that's the state of things in the state of Louisiana. So that was the first story, and that aired for the gubernatorial runoff election last November. And then the series kicked off in earnest in January. And I began with an episode about municipal court, which is where we litigate and charge for misdemeanor crimes, not criminal offenses. So no robberies, murders, or rapes, but all that other stuff. And that story was so important because our municipal court here in Orleans Parish is the highest volume court in the state. And the bulk of people that are churned through that court are people who are poor. And the offenses are crazy making. So I suggest you go back and listen to that story about municipal court. It's a primer on municipal court. In that story, I say that the prison population in Orleans Parish has been decreased by 60% in the last 10 years, which is amazing. So we are holding in our parish jail 60% fewer individuals. Why? Because we built a smaller jail. So I think it's really important to think about what are the structures, what are the systems that we're putting in place in society, because once we have those things, we tend to use them, right? So I think that's important to think about in the public health field too, like what systems are you putting in place so that we can use? If we build a big jail, we're going to fill it. If we build a smaller jail, we're going to incarcerate less. But so this was the second story, a follow-up to the first one, and this was about how municipal court went to the New Orleans mission. And we'll just play the story, and then if you have questions, you can ask them. But just the fact that it went to a homeless shelter, municipal court was brought by the Orleans Parish Defenders to a homeless shelter, tells you how many homeless people are being churned through our system. One judge estimated to me that 40% of the people that go through the municipal court, and that's the highest volume court in the state, 40% are homeless. Nobody keeps statistics on this, so I got a range of estimates. That was the largest one. I think the smallest estimate I got was like 12%. So somewhere in there, we've got a huge amount of homeless people that are being churned through the municipal court. So I don't know how to make it play. Do I do that? And at this, I recorded this the second time that that they went to the municipal, or that municipal court went to the Orleans.
Right here in his robe, and he sets up just like he would in the courtroom with his clerk and everybody right here. He even has his nameplate. It's just like court here.
This is Leroy Perry. He's the reentry coordinator at the New Orleans Mission, one of the city's largest homeless shelters.
A lot of the people that are homeless and hang around here and come here for our services, they have legal problems hanging over their head that if they can't get to, they're afraid to get to. And this is very reassuring to them because the judge comes here and we let them know we're not trying to take anybody to jail. We're trying to get your problem resolved. And that's what they do. They bring them here and they get it resolved.
To understand why Louisiana's highest volume criminal court holds sessions at a homeless shelter is to understand how intertwined the criminal justice system has become with homelessness in New Orleans. This is Unprisoned. I'm Eve Abrams.
People who come through this system are poor.
Brandy Studer is the social worker for the Orleans Parish Defenders and Municipal Court. People who work there call it Muni. Orleans Parish Defenders, OPD, represent around 85% of the people arrested in Orleans Parish, which means 85% of the people arrested are at or below the poverty level. Brandy's job is to keep these clients out of jail by getting them back into school or into a substance abuse program or maybe a bed, whatever each person needs.
You know, a lot of our clients come because they were panhandling or they have a mental illness crisis in public and the cops don't know what else to do with them but to arrest them, or their families don't know what else to do but call the cops. And then they end up in this system. They end up spending a couple of days in jail and getting court costs and fines and fees.
And those are hard to pay when you don't have a job, never mind a reliable place to sleep. OPD estimates that at least a quarter of their municipal court clients are homeless. At least 1/3 suffer with some level of mental illness. The numbers are so high, Muni holds 3 specialized courts: mental health, human trafficking, and homeless court. Homeless people are usually charged with public intoxication or obstruction of a passageway from, say, sleeping, or trespassing, say, sleeping in an abandoned building. Some people are arrested so frequently, the judges know them by sight. Lauren Anderson is a public defender with OPD. She has one client who's been arrested 186 times.
But these aren't people who are walking around with iPhones and calendars, and I mean, some of them don't even know where they are, what day of the week it is. So remembering that I need to be in Section B of municipal court a month and a half from now is just impossible. And they'll say things to us like, well, I remember getting this ticket from this officer, but then one day it rained and my ticket got wet. And people don't believe that, but that is an actual thing that happens. These are people who are sleeping under bridges.
A ticket or summons from a police officer or a subpoena from the court is a sheet of paper and pretty much the only way someone knows when to appear in court. You can call the clerk of court, but if you don't know what section you're in and call the wrong clerk, or your name is spelled incorrectly in the system, or your birthday is off, chances are no one will find your case. So one day, Lauren Anderson, the public defender, she was in court trying to figure out a better way to resolve cases for her homeless clients, many of whom just don't come to the courthouse.
And so it started as kind of an idea to go to the mission and take a bus there and just try to pick everybody up and bring them here one day. And Judge Early's like, why don't we go there?
Right.
That's Judge Early.
I came up with the idea, well, it might be easier. We just came down to the mission and brought the court down there.
Traffic over there, municipal was right here.
The first time Judge Early brought his staff and city attorneys to the New Orleans Mission, it was such a success that the second time he convinced Judge Jones from traffic court to come too. Inside the mission's main building, public defender Laura Bigsby stands outside the chapel with a clipboard. She's waiting to ask people if they want to see one of the judges about a case. It involves some logistics.
So we can access the court database outside of the court building. So we have a couple people at the court, and we basically are like texting and emailing and calling names. Then he's running it on the database and reporting back to us, like emailing, faxing, whatever it takes to get some information about the case back over here. So it's not the most efficient,
but worth it. The idea is to clear warrants for arrest, called attachments, so that the next time these folks interact with the police, they won't get arrested and booked into jail.
So it sounds like people are not even sure what their legal status is a lot of the time.
Sometimes people know that they missed court, but a lot of times people have, court cases in 4 different courts over a span of several different years, and they have no clue, which one they resolved, which one they missed court on, what happened with the case, what they were even charged with.
Sometimes it's the fear of you not knowing the outcome, and nobody wants negativity and wants to hear no or rejection. And this is a more friendlier setting, and not police or anything. Sometimes people have a fear of the law unnecessarily.
Stanley Walsh and his friend Tanyelle are waiting to see a judge. They're sitting in the courtroom, which is more often the living room of the mission's transitional house.
You know that they're genuinely trying to help you in this situation, so you're more willing to just come try to rectify your problems.
Once you come here, you're not in a position where you don't know if you're going to walk out. You see what I mean? So it's one of those things, you come to a neutral ground and outside of the courthouse, and you have a possibility of actually leaving.
This fear of court is common, but people are almost never taken into custody simply for showing up in court. In fact, Desiree Charbonnet, the chief judge of municipal court, says when cases don't involve guns or violence, she does anything she can not to lock up a defendant.
I'm always looking for ways to divert nonviolent offenders from the criminal justice system, because over the years, I've not seen that having any kind of a positive effect on crime or on their lives either.
For every dollar you spend on mental health and substance abuse treatment, you have downstream savings of up to $3 in the criminal justice system.
Jeffrey Rouse is the Orleans Parish coroner. In Louisiana, that means he's in charge where mental health and the legal system intersect. It's estimated that nationally, about 1/3 of chronically homeless people have untreated mental illness. Rouse says once someone's wrapped up in the system, it's a little too late. You can still treat that person, but the real savings of lives and money is in primary prevention.
The bottom line is that New Orleans can be a very, very tough place to grow a brain. From difficulty accessing economic equality, to access to good nutritious food, to access to good education, to lead poisoning, to early exposure to trauma.
We can't fix these systemic problems by arresting people and locking them up. But the court can help. Take David Young. His case was complicated. It involved a domestic abuse charge, and at one point he was suicidal. But through municipal court, he was sent to a mental health facility and then a drug class. Young came to the mission to see his public defender and the judge.
He shook my hand. He remembered who I was. And when I walked in, I said, "Judge, thank you again for saving my life." He did. The judge really saved my life. And he showed concern and just wanting to see me live instead of die.
Judge Early told David Young his fines were dismissed. He had no court costs, and his 1 year of unsupervised probation was complete.
There's nothing on my back now, and I don't have anything to be concerned about as far as for court, and that really feels good.
Which is exactly the point, to get people out of the system so they can move forward with their lives. Unprisoned is brought to you by WWNO and Finding America, produced by the Association of Independents in Radio, with financial support from the MacArthur Foundation. Unprisoned's theme music is by Greg Schatz. Our editor is Vicki Merrick. Learn more about Unprisoned at wwno.org and facebook.com/unprisoned. Subscribe to our podcast on iTunes. I'm Eve Abrams. This is Unprisoned.
Okay, thanks. So I'm still struck by some of the things I hear in that story. I can't even believe it. One of them, I'll just call it out, and then maybe you all can help me, like things that you heard that struck you. But the chief judge of municipal court, a lovely woman, Desiree Charbonnet, when I asked her, tell me a little bit about what you do, Literally the first thing out of her mouth was what I put in this story, that she thinks that when you're talking about nonviolent offenses, locking people up does no good. No good. And so she tries to avoid it in any way she can. And I just thought that that was amazing, that that's coming from the head judge of our court. So clearly we're trying to incarcerate our way out of a host of bigger problems that we're not really trying as a society to systemically address. And so we're putting this Band-Aid, which isn't even really a Band-Aid, it's just get these people that are having a problem out from the public view, right? That's how I see it. But and what things did you all hear or notice? Yeah.
The mental health aspect of that story is quite big. There aren't really many resources for people with mental health problems, so it's either send them to the ER or put them in jail, which are not really good options when they're having an episode.
Absolutely. Did you all hear her that it's mental health is clearly behind a lot of the locking up of people? Absolutely. And we don't have enough resources for folks. Anything else? Yeah. Right. So your interactions, your lived experience as a human in this world, interacting with police and the criminal justice system and courtrooms and judges, is going to determine your willingness or your interest in going into a building that deals with that, right? So a lot of people have a fear. Oh my God, I'm gonna go in here and they're going to put me away, and so they don't go in, and so because of that, then they are. They're not meeting the summons, so then they have a warrant out for their arrest. So then they owe money, they owe a fine, they owe a fee, or if they're stopped for any other reason, they have this open warrant, so the police are justified in taking them in. So just that very understandable fear, because of your lived experiences, puts a lot of people at a disadvantage. I'm really glad you pointed that out. Yeah. Yeah.
It's a good thing, and basically, even though the services are not integrated from a mental health standpoint, but we actually see that at this space in global health, we are emphasizing integration and comprehensiveness in approach of interventions. So when you get a court dealing with a homeless person who may have a mental health issue, they have an SUVs, and some of the problems are comorbidities, and they have led to some of the social problems. Social determinants of health and the public health economy, working with the education people as your colleague here and the students are being aware of what's going on. It's a great thing, and I really want to commend it.
Yeah, this is one of the more positive stories because it's a solution, right? And it was one that was the Orleans Public Defenders that came up with the solution. It's like, oh, let's remove one barrier for people who are being churned through this system. Let's go to them. Let's go to a safe space, a place where they are not going to feel as threatened, right? So it's just changing how the systems are enacted can do so much good. Yeah.
I just have a question for you. Like,
yeah.
Your personal research and experiences, it really sounds like the problem is kind of like a societal level. We need to get to the root cause.
Yeah.
What society level structure do you think, or that you've heard about, that we could put into place that could be like kind of preventative of these like arrests are a waste of time and money?
Sure. Well, there's a lot of money that goes into these systems, right? What if that money went into schools?
Yeah.
What if it went into counselors? What if it went into having doctors in schools, social workers in schools, and in community centers? You know, I think, as Jeffrey Rouse, our coroner, said, address the problems upstream where it's cheaper and more effective, and you can really do substantive work to helping people. I mean, he kind of named all the challenges of living in our beautiful, charming city, right? Access to good health, access to equity, access to a fair education, or to a good education, access to clean water, free of trauma, free of violence. Like, these are the root causes. So if we address them, then we're not going to have to be thinking about locking people up so much. And but those are big challenges. But that's where I think our money and energy should go. Yeah.
Can you also go to the other
I think they're currently just going to the New Orleans mission. They have a really good partnership with them. They can, and they do. And word spreads pretty quickly. So the first time municipal court went to the mission, they had a good turnout, but the second time was way bigger. And they've now gone 4 times. So I think build it and they will come is the motto. Yeah. You know, I'm not, and I'm glad you brought that up. You know, this was my first year on this project, and I personally wanted to go for the lowest hanging fruit. You know, these are not people who have been involved in any kind of alleged violent crime, and so it's much easier to empathize with them. So that's why I was picking my battles, right? So that's why I focused on this system. I don't know of anything like this going on with the criminal court, but most of the time that when you're talking about criminal proceedings, people are either out on bond or they're locked up. So there would also be less of a need. Okay. Oh yeah. And then hi. Mm. Mm.
And unpaid family caregivers are bearing a $470 billion burden every year. There was a report that came out last year.
Wow.
But also, in terms of solutions, wanted to encourage people in the room to support a bail ordinance that Orleans Parish Prison Reform Coalition co-wrote with Bill Quigley from Loyola Law School.
Mm-hmm.
That would provide for people with low-level city offenses and municipal offenses to not be held in jails because they're too poor to pay their bond. So it's to address debtors' prisons. So a lot of people that don't have mental illnesses may be just poor. But then you have those with mental illnesses, so we need to find solutions for them as well. Anyone who's in, we have, if you go on Facebook and look up Healing Minds NOLA, you can see some of the work that we're doing to legislate for better policies and funding for more long-term support services.
And I think there's something at City Council tomorrow morning at 10 about bail and bond reform. I'm pretty sure at 10 a.m. in City Council chambers. Thank you. Thank you. So bail and bond, huge issue, right? Huge issue that we could talk about. One thing that I heard over and over from public defenders was we just want to keep them out of jail. Get people out as soon as possible, keep them out of jail. Because what happens when you're in jail? Not only is it a less than lovely condition, but you're also not at work, you're not with your family. There was an amazing article in the paper a couple months ago about a woman who had a very serious health condition and was incarcerated when she went to get a routine clearance. Oh, we only have 12 minutes to go. Okay. Anyway, I could come back and talk about bail and bond another time. There's one more story I wanted to play, or we could keep talking. I don't know what people want to do. Listen to the story. Okay, do you want to take a 10-second comment?
Manny has always been part of it.
Okay, so this next story talks about drug addiction. So we've talked a bunch about homelessness and mental illness, and a huge, huge issue with our current prison system and jail system is that we are locking people up for drug offenses. So this story gets into that, and also familial relationships.
Part of his family, but he's also missed out on a lot. I'm looking at framed pictures with his sister, Johnny Mae Hills Silv.
That's Bernal, my son. They call him Bookie. This is one of my granddaughters. This is all my sisters. My baby sister Angie, she live in Mississippi.
Was it her wedding?
That was her wedding. My sister Gail, and that's Janice.
Yeah.
That's all of us. That's all girls.
How come your brothers aren't in that shot?
My brother was in jail.
For the wedding?
Yeah. Every time you look, he was in jail.
Manny's an addict. Over the last 25 years, he's been convicted several times for drug possession and other petty crimes. His story is pretty typical of the people who fill up our nation's prisons. This is Unprisoned. I'm Eve Abrams. I've been following Manny and his family as he finishes up his 6th sentence and heads home. In nearly every state, prison populations have exploded, in large part because of drug laws and the people like Manny Hills, who are arrested and incarcerated for those laws. While many defendants may be imprisoned for other charges, a federal program that tests people at arrest in several cities has found that nearly 2/3 tested positive for at least one illicit drug. Like so many addicts, Manny sometimes committed crimes so he could afford to score more drugs.
We're going this way.
Johnny is the oldest of 8 kids. She just turned 60. Her brother Manny just turned 56. So, you said he was in like 3 times before this time?
For drugs.
He had an addiction problem?
Yeah, he was on them. Girl, man, he used to get in my house and steal all my little stuff. He stole my hot water heater out here. I had a brand new hot water heater. He stole that from me. Yeah, he stole all my stuff, though. But I still love him.
Johnny lives in St. Bernard Parish.
Hey, my baby!
I meet her one day after she gets off work. She hops out of her cousin's truck wearing work boots and carrying her hard hat. Johnny says when she's at the oil refinery, the only thing that lets people know she's a woman is her lipstick. Then she reaches into her shirt pocket and reapplies it. Johnny points at the roof of her house, where she lives with her daughter Gabby.
But it had a hole right here on the outside right there.
Yeah.
On that side. And Manny got it back on drugs. And Manny used to get in there, up there, and go through my attic and come down. I had some stuff that I had from my mama. Manny stole all that. I had all kind of power drills. Manny stole all my stuff. Manny stole my mama watch I had. And the lady across the street says, I be seeing your brother come out the door. See, he got no key to get in my house.
Because Manny didn't have a key, Johnny knew he was breaking in, so she had her son nail a board over the hole, on the outside and the inside, making it impossible for him to climb in again. Johnny's daughter Gabby saw Manny come by one night, look up at the hole, shake his head, and walk away.
Did you ever talk about it with him, like you did this?
Yeah. All he did was laugh. Girl, come on now, come on now. You know, and I know he did it, because I could tell when he be lying. But yeah.
Johnny says when Manny is in prison, she misses talking and clowning around with him, and she worries someone might take advantage of him. But she also feels relief that he's not asking her for money and leaning on her for everything. This kind of sentiment is not uncommon among families of incarcerated addicts. According to the Bureau of Justice Statistics, about 50% of states' inmates meet the medical criteria for drug abuse, but only 15% of drug-dependent inmates actually receive treatment. Manny was one of the lucky ones. About 8 years ago, he graduated from a drug rehab program funded by the Department of Corrections, or DOC. He's been clean since then, but he hadn't completely changed his company and was arrested 5 years ago when he gave a ride to someone who left drugs in his car, he says. But the question remains, should substance abuse be viewed as a public health issue instead of something we lock people up for? Across America, families like Manny's have almost no access to professional help for addiction. Michael Botticelli is the federal drug czar and also a recovered alcoholic. He's called imprisoning people for substance abuse inhumane and says we can't arrest and incarcerate addiction out of people. Leo Hayden was director of reentry for Louisiana's Southeast region, the reentry program Manny was in. Hayden says just because people are complicated, maybe even exasperating, doesn't mean they should be in prison.
Some people just don't need to be there. And that's a fact. I mean, all criminologists will tell you that too as well. We've become so entrenched on incarcerating individuals, everybody's a nail because we the hammer.
When I first met Manny, he was finishing up his most recent sentence. This time he went through the reentry program led by Leo Hayden. It was family night, and Johnny and her sister Janice left work early to see Manny. They brought a big box of food.
He told us what all he had. He wanted. He wanted church's chicken, pork chop.
That's all I wanted, turkey, chicken, and pork chop. I wanted meat.
I had some gumbo in the freezer for you. Bookie took it and ate it today.
Oh, I'm a Kantian.
Baby, looking good, boy.
The siblings hadn't seen each other in years. They can't talk on the phone very much because phone calls home from prison are really expensive. They cost 20 to 30 times more than regular phone calls. Johnny's on a tight budget, so she had to tell Manny to stop calling.
So when your sister tells you to stop calling because she can't afford it...
I keep calling. Like I said, I don't want them to answer the phone. I just call, when they say hello, I can hear them, I just hang up the phone.
That's right. Manny found a no-cost way to stay connected. Sort of.
Just by hearing their voices, make me feel good,
Yeah, but sometimes he just call, and then we say hello, the phone click off. He just be want to hear our voice.
As long as I can hear their voice, I'm cool. Okay?
Manny, whose real name is Calvin, has a pork chop in one hand and a piece of fried chicken in the other, and at the same time was introducing Johnny and Janice to everyone who walks by.
That's my sister and them, and I love them to death, So they're my good support for me,
We need you just as much as you need us, Calvin.
Yes, it is. And I know one thing. I'm 55, I can't go no more. This is my last one,
Yeah, mistakes that we made, but you got to get over it. Can't do that no more. I told him we getting old, too old for this.
Manny could sit down with his sisters because he was in the reentry program. Leo Hayden chose prisoners for the program who were toward the end of their sentences, especially those who had strong family support.
Everybody that comes into my program that has a family, I meet with them because it is probably the number one strength that they bring to the table is their family and their community.
Manny finished his sentence and was released on May 17th. What happens now could go either way. 50% of released prisoners in Louisiana are back inside within 5 years. Statistically, because Manny's over 50 years old, he may have a better chance of staying out. But things are looking a little rough. He had a job when he got out, but he quit, saying he didn't have the gas money to get to work. While reentry programs are supposed to be a bridge from prison back into the community, the program Manny was in ended before his release. So when he got out, Manny was left without any follow-through or support. In fact, when I called Leo Hayden to ask about Manny's situation, Hayden didn't know Manny was struggling. He called Manny right away. Hayden told me, for program graduates like Manny, quote, everything doesn't necessarily go storybook smooth. There's a reason he was in prison in the first place, end quote. That reason, his chronic addiction and unreliability, is already causing friction in his family. His sister Johnny would like to see him succeed, to be there for the next family picture, but her patience for having him in her house has an expiration date.
When you come home, I'm going to give you 6 months. You can't stay with me forever.
Unprisoned is brought to you by WWNO and Finding America, a national initiative produced by AIR with financial support from the Corporation for Public Broadcasting. Unprisoned's theme music is by Greg Schatz. Our editors are Vicki Merrick and Katie Reckdahl. Learn more about Unprisoned at wwno.org and facebook.com/unprisoned. And subscribe to our podcast on iTunes or Stitcher, and while you're there...
So just so you know, Manny's actually doing very poorly, and his family thinks he's using again. And I have spent many hours on the phone with them looking up things on the internet because they are literally without resources, and it is completely falling on his family to help him, just like the statistics we read. So not a happy ending to that one. Please take a card. I put some on the blackboard there, and there's some on the table here, and feel free to get in touch. Thank you guys so much. Appreciate it.